one of the things I wanted to talk about is a device called the Watchman or the Amulet device. So I talked about stroke with atrial fibrillation. The reason why people have stroke with atrial fibrillation is because when the heart is so erratic and it doesn't beat properly, the blood starts pooling in your heart. And there's this little pouch in the left upper chamber of the heart. It's called the left atrial appendage. It's in the left atrium. Blood starts pooling in the left atrial appendage, and it starts forming little blood clots that can go to your brain and cause a stroke. So routinely when people have atrial fibrillation, we put you on a pill that's called a blood thinner. What it does is it keeps your blood thin. And what the idea is that if your blood is thin, it's not gonna cause a blood clot in your heart. The problem is we only want to prevent blood clots in that part of the heart. The blood thinner keeps your blood thin from head to toe. So what it does, it increases your risk of bleeding. So if you have a cut, if you have a bruise, you bleed. But more than that, we worry about internal bleeding. You have a small ulcer, you have a small polyp, you're gonna bleed, and it's not gonna stop because now you're on a blood thinner that's gonna prevent you from clotting. The same thing, you fall, you hit your brain. Your body has a natural process of clotting, and we're giving you a medicine to stop the clotting process. And so that increases things like bleeds in the brain and things like that. So there is a therapy called a left atrial appendage closure. What it is we close off that left atrial appendage. In that way, you don't have to take a blood thinner all your life. This is a video of how a Watchman is put in. Again, it's done through a little IV in your groin. It takes about 15 to 20 minutes. We bring you to the hospital. We go into the heart with this little tube. We find out that appendage. We look for the appendage. We find where that appendage is with this little tube. The appendage, I always tell people, it's like your thumbprint. Everybody's appendage looks different, so I do not know what your appendage looks like until I'm in there. So we look at the appendage, we find out what your appendage looks like, and then we figure out what size device or what type of device is the best device for you. So this, in this video, you're gonna see us put in a Watchman device. The Watchman device initially came to human trials in about 2004 and was approved by the FDA in 2016. We started our Watchman program in 2016 and have been able to successfully get rid of blood thinners in many patients. And you can see how that device is being put into the heart. It looks like a little plug is what it is. I tell patients this is not a filter. It doesn't filter anything. What it is it's a little plug that goes in that appendage, and it helps the heart kind of heal over. So once that device is in there, it's got little anchors that hold the device in place. So we size it to your appendage. So it's custom, almost, we customize it to your appendage. And then once it's been in there for a while, you'll see that the heart tissue grows over it. And once the heart tissue grows over it, it kind of heals off, and then you get off the blood thinner. And that process is usually about 45 days to 3 months. But it helps you get off the blood thinner, and it cuts off your stroke risk by at least 96% from atrial fibrillation. Now, we still keep patients on aspirin and some of the other blood thinners like Plavix. If you have a stent, you might still stay on those medicines. We might still keep you on aspirin because stroke does not just happen from that part of the heart. You can develop stroke from arteries in your neck, plaque in your aorta, things like that, or sometimes blockages in your brain arteries. So we might still keep you on the aspirin, but you don't need a blood thinner like Eliquis or Xarelto or warfarin or one of those blood thinners. Next. This is an Amulet device. It's a different type of device. Play that. It looks different than the Watchman device. So sometimes you might hear us say, oh, you got a Watchman device. And in some patients, you might hear that you got an Amulet device. Pretty much, we pick the device that is best for your appendage. As I said, your appendage looks, everybody's appendage looks different. So we pick the device that is best suited for you after looking at your appendage during the procedure. Sometimes we do a CAT scan of your heart to figure that out early, but some patients are not candidates to get a CAT scan, so we might not do a CAT scan. And that's what it kind of looks like. This is an animation, but the heart just heals over it, and once it heals over, it helps you get off the blood thinner safely.